good morning and happy new year. Since y'all want the S off of it, we want y'all to have all the happy new years with me, Bella Wellness, with our weekly wellness. And that's why myself, Comedienne Joy, and the wonderful, amazing Dr. Mia, we like to give you these amazing tips so you can have an everlasting, wonderful, amazing years to come. Good morning, Dr. Mia.
Good morning. Happy New Year, everybody. We made it to 2025, and in my world, it's going to be the best year ever. So I hope y'all are in agreement and claiming the best year ever. So for those of you who don't know, I'm Dr. Mia, your B3 specialist and board-certified gynecologist at Me Bella Wellness Center in Birmingham, Alabama, where we offer gynecology for women and adolescents, as well as hormone pellet therapy, weight management, intimacy services, total wellness with supplements, and laser hair removal for both men and women. Our goal is to help you live well, so you can age well, so that you can experience everlasting intimacy. Comedienne Joy, tell these people who you are, girl. And,
That's right. I am the one, the only, the famous Comedienne Joy, the owner of the Eat, Drink, and Ride food tour. Not only the best food tour in Birmingham, Alabama, but the only food tour in Birmingham, Alabama, where once you get your hormonal life together, I take you on this beautiful party bus, and we go to 5 local restaurants in 4 hours. We have a great time. You get to learn about some of the amazing local restaurants that's in town, so you can go out and eat and celebrate and do it in moderation. Yes, I do that. Say it again.
Small portions.
Small portions. That is right. That is right. I also can plan your amazing travel, so that way you need to relax and unwind. Anywhere in the world you want to go, you need a passport to hang with me. I don't do that much domestic stuff, but I'm going to start looking into stuff for some of y'all passportless people. You hear all them P's we popping today?
Yes, get your passports together.
Yes, your global entry, all of that. But you know why I can pop all these P's? Because I've been following these wellness tips, because we're talking about weight management when you're in those perimenopausal, those menopausal stages, when you old and got all this right here, you can't move them joints.
Right. So that's what we're talking about today, managing weight during menopause, which can be very difficult for a lot of people. So make sure that y'all share this. We're going to be giving some good information. You know, everybody's on the weight loss kick. And
they holding our way at the gym. They're up there trying to blow Peggy Keeble up right now. Y'all better stick with Peggy.
Right. I already got mine scheduled, baby. 6 a.m. Monday, Wednesday, Thursday, 7 a.m. Friday. Y'all can't get that time spot, but I do have that one.
Exactly. And I've even been in the gym this week, looking forward to getting there today before I got to get on that bus. But one of the things that I've learned that it's my friend. You see this right here? It's full of water. It is your friend. It will help you on vacation. It help you when you're at home. So, Dr. May, I do want to ask this one question that I have been seeing over the years about water. Should you drink it room temperature or cold? Because, and of course, you can't believe everything on social media, so that's why I ask professional, because they said if you drink cold water, that it doesn't help you to lose weight as fast, or it helps you to even be bloated versus if you drink it room temperature.
I've never really noticed the difference. I think drink it the way you can drink it, and if you can drink plain water, whether it's warm or cold, it's fine. So some people like it really cold. I like mine cold when I'm sipping on it, but if I'm just trying to get my water in, I will do room temperature. But I really don't think it matters as much about the temperature as what you put in the water. So my goal for my people is to use just plain water. And if you feel like you need to put anything in it because you don't like the taste of water, which I have never understood that, because water has no real taste if you get the right water or you filter your water. But anyway, you could put like a piece of fruit, like you could put a little lemon juice or a little lime juice in there. If you want to put cucumbers or strawberries or something else to kind of season, to kind of flavor it, but make sure you keep it cold if you leave fruit in there, because it will mildew. If you're going to just put a little bit of the fruit juice in there, you still want to make sure that, it doesn't get old because it's got that juice. But otherwise, just drink plain old water at room temperature or cold, whichever way you like it.
So what about those 0-calorie flavored waters? Are you saying no?
I don't like it. I don't like it. They say 0 calorie, but it's something in there. And what's in there? Can we just get some plain water? At least half your weight per day, so that in ounces of water. So if you weigh 300 pounds, we say at least 100, but you could go up to 150 ounces of water and you'd be fine. But I think the benefit of water is not so much that it makes you just lose weight because you drink it, but what it does is it makes you full faster. It decreases your hunger cravings because you feel full. It decreases the amount that you eat during a meal, especially if you're drinking water during your meal. I like it because it slows me down during a meal because, I really like food a whole lot, probably abnormally so. So to slow myself down, I practice like putting my fork down and sipping water between bites. And I do that because if I eat really quickly, I can't recognize when I'm satisfied, and I tend to overeat when I eat fast. Whereas if I slow down my eating with my sips of water in between, putting my fork down between bites, mindfully eating, that's something we'll be talking about in the challenge that's coming up that y'all can sign up for. It's free. January the 6th, 7th, and 8th. So that's Monday, Tuesday, and Wednesday. And one of the things we're definitely going to be talking about is mindful eating. So actually being in the moment when you're eating, not eating on the go, taking your time, enjoying the food, making a nice presentation, trying foods that you like, trying flavorful vegetables to, spice up your food without spicing it up with fat, salt, or sugar.
Okay, so is it that our body is changing, right? Because we have that perimenopausal stage and we have the actual menopause stage. So what should we do? Well, first of all, what if like you may be a person like me? I don't have no house anymore, so I don't have I've had a hysterectomy. So I may not know when I'm in.
I know what you're talking about. I ain't got no house. I'm like, yes, you do. You got a daughter's house.
Yeah, let me just make it plain. If you've had a hysterectomy,
okay,
how do you know when you're getting into menopause? Because in my mind, I'm still 25. Okay, maybe 26.
Right.
So how would you know that you're getting in menopause? Is it because you're just older? Are you going to see some sudden changes?
Good questions. Definitely. So it's this whole conversation is what is perimenopause, menopause, and postmenopause. To me, it's all about the same. What it means is that you tend to be having some symptoms that negatively affect your quality of life. In perimenopause, that's when women will first start having a decline in their testosterone. And when that happens, some women will notice some of these symptoms or all of these symptoms: night sweats, not sleeping well, waking up in the middle of the night, having a difficult time falling asleep, decrease in desire for physical intimacy, decrease in enjoyment for physical intimacy, the fatigue, not just being a little tired, but waking up tired, being tired in the middle of the day, tired before you go to bed, but you still can't go to sleep. The mind fog. So you walk in the room, like, literally when I leave the house, if I probably come in and out of the house 3, 4, 5, 6 times if I'm not balanced and I don't have my pellet. It's probably just 1 or 2 times if I'm balanced with my pellet. So that mind fog, you can't remember the word, you can't remember what you were about to do, what you were about to say, and just that fog where you just can't focus as well. So it affects your work and it can affect other things in your life. And then mood changes. To me, that's one of the most important and significant ones to recognize so that it can be treated, because when your testosterone declines and what we call perimenopause, meaning you're still producing estrogen. If you still have a uterus, you're probably still having regular cycles. You're just starting to have all of these new symptoms from the decline in testosterone. And so then the mental health component, so increased anxiety, increased irritability, increased depression, or new onset of either of these, and you've never had them before. That's all a sign of perimenopause, which is when you are still producing estrogen. So your ovaries are still working. They're just not producing as much testosterone. And so you can have these symptoms. And the other part of it is it can cause joint pain and belly fat. So you tend to notice that it's easier to gain weight, harder to lose weight, and you tend to gain more weight in your belly. And the reason is because of the low testosterone, which makes you drop muscle. You're no longer holding on to muscle. So now you're getting more fat and it's going straight to the belly. So all of those are signs and symptoms of perimenopause, the onset of the transition to ultimately menopause. And perimenopause can start in the 30s.
Wow.
And last for, forever, if you don't do anything about it. And then we consider you postmenopausal when you go a whole year without a cycle, or if you're somebody who's already had a hysterectomy, so you don't know anything about your cycles. It's also when we look at your numbers. We can get lab work to show, okay, you're having these symptoms, but you're like 48, 49. So you could be in menopause, meaning you're not producing any more estrogen, or you could just be perimenopausal, meaning you're producing a little estrogen, but you're not producing much testosterone.
Interesting. So how does that, because some of those are like the normal part of life,
Yeah.
how can we try to manage the weight gain if that's kind of like a part of getting older?
Right. That's a very good question. So the way we do it is with lifestyle changes and behavior modification and coaching and accountability and figuring out what works for our body. And you're right, it's a difference, because when I first lost my weight after I had my baby, I wasn't in perimenopause. I was like 33. I gained 60 pounds when I had her. It took me about a year to really get it off. And that was after I started my training, I think. No, that was 2 years. So it took me 2 to 3 years to get it off, because I didn't get it off until I went for training to learn how to lose the weight and teach my patients how to lose the weight. And then once I did that training, I think in 2010, that's when I was able to lose my weight between 2010 and 2011. But that required lifestyle change. But again, I wasn't in perimenopause. So I lost that weight. I was able to keep it off without a problem, had some great new lifestyle, techniques. I was weighing regularly. I was keeping my BMI under 25. And then all of a sudden, like at 37, 38, I started to notice this weight gain, and I wasn't doing anything different. I was still working out. I was still eating pretty much healthy, but I was starting to have some other symptoms, like not sleeping as well, having a few night sweats. My mood was a little off. I was a lot more irritable. And so that was the difference. And so when I gained that weight, it was very different in me losing that weight compared to losing it before I had hormonal imbalance. So once I was 38 and I started gaining the weight, I went for training for my pellet too. And when I went for training for my pellet, I got a pellet myself, not even realizing I needed the pellet. They were like, hey, just get your blood work. And if your numbers are low, we can give you a pellet and you'll have a better understanding of it so that you can explain it better to your patient. So when I went, my testosterone was 10, which is really low. So I say, if it's under 70 with symptoms, we can treat it. And I got a pellet, but I didn't even know I was feeling as bad as I was. It wasn't until I started sleeping through the middle of the night. Sleeping through the night and not having the night sweats and wanting to have high intimacy again, enjoying it more, that I noticed that I was like, dang, I was in perimenopause and I didn't even know it. I was just thinking these were just normal symptoms, and I was so busy I couldn't think about it. But once it was time for me to lose weight, when I got the pellet, it made it a whole lot easier to actually lose the weight and keep it off. But it was a different experience from being normal, young, healthy, and hormonally balanced, trying to lose weight, to being in perimenopause and hormonally imbalanced. I really could not consistently get the weight off and keep it off until I was hormonally balanced again with testosterone pellets.
And the thing with that is some of those symptoms, they're so gradual.
Yes, and minor, and sometimes you have them and sometimes you don't. You know what I mean?
And then we chalk it up to, hey, I'm just getting old. I'm supposed to not remember. But we are created to remember and to be focused and to have mental clarity. And so those pellets are definitely a game changer.
Game changer.
Yeah, because you and I had been doing different seminars and networking events for years. I was way younger, and I distinctly remember as I kept getting younger that I was listening to you on an interview one day, and I'm like, oh my God, I have all of those things. Mm-hmm. But I had to realize now this has been 6 or 7 years post me first meeting you, hearing you say that. I'm like, I have all these things. I have to go see her. And then after I started getting the pellets, I was like, wow, I can remember again. I do have energy. And just listening to you talk about not sleeping well and the night sweats is foreign to me. Yes. Because I've been getting the pellets for so long. I sleep at night. I have energy. I can think about all the things. And it's just a whole game changer. And I tell women all the time, I'm like, if I hear about these pellets getting ready to go off the market, I'm going to cash out every piece of savings I have, because we're going to buy them up.
So we go all invest in the pellet company. I know that's right. But yeah,
Exactly.
that's a very good point. It just really does make a difference. And I think you don't know how bad you feel, because one thing is we're not mindful. All we're doing a lot of times as women is we're hustling and we're working and we're trying to make as much money as we can, spend as much time with our family as we can. We don't really, handle stress. So we don't even stop and think about, how do I feel today? Like, how have I been feeling? You know what I mean? Like, we don't stop to think about that because we're so busy going to the next thing, especially as entrepreneurs and career people. We are trying to get the next bag. So we're not stopping to think about how we feel, and it just kind of sneaks up on you. But what I noticed is when I got the pellets, it wasn't like me just getting the pellets, I lost the weight. So I don't want anybody to think that. What happened was my mood was better. So I was less irritable and I had less emotional eating. So I didn't have all those cravings anymore. Then I actually had more energy. So I felt like getting up to exercise. I could put myself in a routine. I had energy throughout the day to do the things I needed to do to help with the weight management. And then finally, I could actually see muscle definition again. I was holding on to muscle again, because when you don't replace your testosterone, everything turns really soft and you lose a lot of muscle, and when you don't have muscle, that slows your metabolism. So the more muscle, the higher your metabolism. That's why gymnasts and people who really build a lot of muscle, they have a high metabolism. They have to eat all the time. However, when you start to go through that perimenopause and your testosterone is declining, you're not replacing it, that muscle is going away. So that's why your booty starts to change. It becomes longer. It doesn't sit up anymore. You start noticing more fat in your belly. You didn't have a lot of fat. You start noticing more fat under your arms. I still have it, even though I get the pill and work out real hard, but I guess it's a genetic thing. But like, you notice that you just don't have as much muscle. So I think that indirectly, testosterone balance will definitely help make weight management a lot easier, and it helps with so much with your appetite and your mind set, because you mentally feel so much better.
And the other thing that I learned from you is that you told me to download, I think it was MyFitnessPal, and to
Mm-hmm.
start journaling what you eat. In my mind, I wasn't eating all that much.
Until you start
When
counting the calories, you're like, oh my God.
Right. And so I'm like, oh, I'm eating this, 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 and this. And then there's also the portion size. And
Mm-hmm.
then I have to also ask myself, was one thing that you talked about was the stress eating.
Yeah.
Why are you eating this? Are you eating
Right.
this
Why are you
because you're
craving
stressed?
salt and sugar alternatively?
Yeah.
That.
So it's all of that. And so I think, for at least for me, once I recognize that, thanks to you, it's about making better choices.
Mm-hmm.
And, once you start doing that, and then I had to learn, okay, yes, I can work out today, but if I'm still eating at Golden Corral for breakfast, lunch, and dinner,
Right. I'm not
um,
going to lose any weight.
none.
And then I'm glad you brought up that point. First, I'm glad you brought up the point of measuring, not, you didn't say measuring weight, but journaling your calories. So knowing how many calories you eat, when you start paying attention to your calories, it makes you make different choices. So if I know I'm supposed to get 1,800 calories to lose weight or maintain weight, I can't eat at a fast food restaurant for one meal, because one meal at a fast food restaurant could easily be 1,800 calories, especially if you do the soda, the fries, and the sandwich. So what it makes me do is make different choices. So if you're actually writing it down, so you're keeping up with everything you put in your mouth, including juices and sodas and your alcoholic beverages, all of the coffee, if you put cream in it, if you put sugar in it. And some people say that seems obsessive, but what I say is I would be obsessive for my health. So if that's what works, that's what works. And usually when you count calories for about 2 or 3 weeks, what you notice is that you eat the same foods over and over. So you can save it in your favorites and you can easily keep up with your calories. And if you stay within your calories, you come in and you do that resting metabolic rate test, so you know exactly how many calories you need to eat to lose the weight. Then you can't mess it up. Either you gonna eat 1,600 calories when your resting metabolic rate is 1,800 and you're gonna lose weight, or you gonna eat 2,000 calories and you're gonna gain weight, or you're gonna eat 1,800 and you're not gonna lose or gain. You're gonna stay at the same weight. And the other thing that people hate to do, they hate the doggone scale. I'm talking about the scale that you're supposed to get on. Nobody wants to get on the scale. They don't want to see what the scale says. They say the scale lies. They say that if you Black in America, then your BMI does not have to be within the norms of society because we bigger boned.
Now, you know, Dr. Mill, they do need to have a Black scale and a white scale. I mean,
no,
for
ma'am.
real.
No, ma'am. So those scales were based, the numbers were based on what increases your risk of chronic disease and, you know, high blood pressure, heart disease, and all of those things. So that's how they base the BMI. So they say if you're normal weight, you don't have as much of a risk compared to somebody who is overweight, obese, morbidly obese. And then it's a new destination of a BMI over 50 now, because unfortunately America is getting larger and larger, and most unfortunately it's affecting our kids. So we're seeing children with chronic disease at a much earlier age. So even though we make light of it, you know, this whole weight thing, it's really serious. Like, our children and children's children are going to have a lower life expectancy than us because of obesity. And that is a preventable cause of death. If everybody would be healthy, eat healthy, lose the weight, keep a healthy weight, then we would all live longer, more vibrant lives, feel better, and we'd be less likely to have all this chronic disease.
So do you think that is with the future because we're more of the drive-through generation?
Yeah, and processed food. And they put in America, they allow them to put all kinds of toxins and poisons in our food. We have stuff in our food that people in other countries have never heard of because it is against the law in those countries to put that kind of crap and feed it to the people that they love in their countries. However, in America, they can put whatever they want in our food. And so that is another big reason we eat fast food, but we also eating this processed food with all of this genetically engineered stuff that we know can cause cancer and all kinds of other things. But that's what a huge number of people in America are eating because food has gone up and it's expensive to eat healthy. It requires a lot of work and sacrifice and planning. You know what I mean? You got to actually pay attention to the sales and try to go get your meat when the meat is on sale because everything is more expensive. So it is more expensive to eat healthy, but America makes it really hard for us to live a healthy lifestyle.
I totally agree with that. But it's up to us to move our bodies so we can walk in the neighborhood. Now we know gym memberships all over the country. They're super cheap. So you can get it $9, $10. Because I used to walk in the neighborhood. I just don't like pets.
And you
I don't
can
like
exercise at home now with YouTube. Like, you can pull up anything you want. Now, I don't recommend it for somebody who does not have any history of exercising and being taught how to correctly exercise. Because the other part about it is when you perimenopause or menopause or postmenopause or andropause or all those things, you're more likely to have an injury too because of the wear and tear that's been on your body. So you have to be careful with the exercise. So I do recommend starting with the trainer and doing simple things like walking. Don't start off running marathons and you have not exercised in 15 years. If you have never run and you are in your 40s, that's over for you. You don't need to start running at this point.
Yeah, your mega knees gone.
Your mega knees been gone, and then you don't want to add running on top of it. So I would say get a trainer, do something. I mean, because walking is great, but in our age group, we really need resistance training. Like, we need the resistance training. I even tell my patients, if you can't do but one thing, do your resistance training because you can get your heart rate up with resistance training. You can do some jumping jacks in between. I don't jump, so I do my jumping jacks where I'm doing side to side like the old ladies because I don't put any unnecessary stress on my knees. You can walk in between. You can do high knees in between to keep your heart rate up. But it's most important to get that resistance training in, not only for your muscle mass and your metabolism and your weight management, but also for your bone mass, because as you age and mature and your hormones start to decline naturally, you get bone loss, and that increases your risk for a fracture. So resistance training exercise actually helps with bone mass and muscle mass.
So one thing that I've started doing that I actually enjoy is I do the elliptical and then I have it up on the random. So that way I have that up and down on the heart rate, but I also have added the resistance to it.
Oh, yeah.
Yeah, so that way I'm getting this part in as well as the cardio, but I'm also getting that muscle toning for resistance.
And that's actually great exercise for our age group because it's not like you putting a lot of pressure on your knees. The elliptical, that was the whole point of it, was to take the pressure off your knees. If you're doing it correctly, you're not going to put a lot of pressure on your back either. So I think that's great exercise. That's reasonable. You don't have to exercise for 2 hours in order to say you're exercising correctly. You can do 30 minutes 5 days a week, and that is adequate exercise.
Exactly. So I do my committed 45 minutes. I put my earphones on, have my Joel Osteen, and I'm good to go. You know, sometimes I'll try to implement a few other things because I want this to be gone. But you know how I make this stomach leave? I stop looking at it. That's what I do. If I don't look at it, I don't see it. Ta-da!
But the other part too with exercise, finding some good core exercises, because that's going to help protect your back. Because as we age and mature, a lot of people start having more back pain because of just the wear and tear on your body. Normally, positioning to I forgot what I was going to say. But resistance training and stretching are going to be key, and making sure you have the right shoes and all of that stuff too. So don't go get your shoes from 15 years ago that you used to wear to work out. You need to probably go get fitted for some new shoes, because all the things matter when you perimenopause and when you over 35, 40. You got to have the right shoes. You got to use the right technique so that you don't hurt yourself. Oh, I was talking about building your core. So I just got my pellet and I was like 3 weeks late. So my little focus is still a little off. But that's what I just remember what I was going to say. What was I going to say real quick? So
you were talking about the core.
Oh, yeah, but making sure you exercise your core to build up your muscles in your abdomen so you're less likely to hurt your back. So I think that is very important with the resistance training, at least making sure you're doing some crunches. You can do your planks. Make sure you're doing it correctly so you don't hurt yourself, but making sure that you build up the core and making sure that you're stretching regularly. So even if you don't exercise that day, my new thing for this year is I need to at least get, if it's not my day to exercise, I can get on a Peloton or walk around for a bit and then really stretch well so that I can, stay stretched out, because as you age and mature, the stretching is going to be key for decreasing all those different aches and pains that you get from all this wear and tear on these bodies.
I got to ask you this question because everybody's doing it. Those shots, the Majono, those Zempic. So everybody's like, forget going to the gym, because I even saw this spoof on TikTok. The girl looked in the gym and said the gym was empty because everybody's getting the shot. So what's your thought on that?
So my thought with the shots, I think the shots are a great medication if used appropriately. And you're right. Many people are not using it correctly. They're going to these places where they just get them the shot. They weigh them and they do their own thing. So the difference so the reason I like the shots is because it's a good drug. It helps to control your thinking about food, your portion size. It helps with insulin resistance. You take the shots once a week. But the shots should be put in place with a healthy diet. So understanding what your resting metabolic rate is, making sure you're still getting all the calories you should get in, because the shots make you starve yourself. And people get excited about it because they're just not hungry and the weight is dropping. But what they're losing is a lot of muscle. So if you're dropping weight really, really quickly, it's muscle that you're losing. And when you lose muscle, once you get off those shots, your metabolism is going to be even lower than it was before the shots. Your appetite is going to increase again because now you're not controlling it and you're going to gain all the weight back. So if the shots are used appropriately, meaning you're on a regimen and weight management program, you're making sure you're having breakfast in the first hour, you're still getting your 60 to 90 grams of protein in a day based on your weight. You're eating the frequent small meals and not starving yourself, and you're doing an exercise routine where you're doing the resistance training and the cardio, then you will have a great success with the shots and you can come off of them. I've used the shots in the past. I use them differently. I usually use them for about 4 to 6 weeks because I can't tolerate it GI wise. And that will help me get on track, kind of retrain things. Then I get back on track doing my frequent small meals, counting my calories, and I can continue to lose off of the shot. And to me, that's what weight management drugs should do. You should be able to use them while you're learning how to change the behavior, while you're doing the behavior modification and the lifestyle change to make that easier for you. And then you should be able to wean off the medication and continue to lose and continue to maintain your weight, because while you were on the medication, you were really just developing a lifestyle that you can continue to keep the weight off. So what people are doing is they depend solely on the shot. They're going and grabbing some fast food. They can only eat a little bite of it. They're not eating enough calories. They're eating under 500 calories, 600 calories a day. The weight is falling off. They're excited about it, but they're losing muscle, and it is really bad for your body, your metabolism, and your health for your weight to go up and down like that. And most people don't want to do a shot weekly for the rest of their lives. So if using it as a help aid and using it because you have insulin resistance and it's harder to lose if you're not treating insulin resistance, those are the right ways to lose the weight. But I think being on a regimented program with a professional that can show you how to lose the weight and keep the weight off and really change your lifestyle so that you're not dependent on anything, but you can keep that weight off because you just live a healthy lifestyle.
So otherwise, you're just going to be on the shots and just be fat.
Yeah, or you're going to be on the shots and then you're going to stop losing on those after a while if you're not changing your behavior. So if you're still drinking sodas and juices and eating the stuff you want, drinking all the alcohol, not exercising, eating some days, not eating others, then your weight is going to come right back. And it may come back higher than when you started with the shots from the beginning because you just messed everything up with this starving yourself.
Well, what they got for the people that lost too much weight and their head's too big? They got something for that right there because they look crazy.
Oh, going to the gym and building up some muscle because you probably got a big looking head because you lost the weight really fast and now you don't have any muscle. So you just skin and minimal fat. And so your head looks really big because you did not lose it the right way. So I think it's important to really, figure out what works for you. It's going to be different for everybody. Find something that works and lose the weight so you can keep it off so that you can live well, age well, and experience everlasting intimacy.
Exactly. So you have a weight loss challenge coming up this week?
We do, and I'm really excited about it. So I will be on the weight loss challenge on Monday night at 7 p.m. Central Standard Time, Tuesday and Wednesday. And then on Thursday, for the people who purchase the VIP, we're going to have a discussion session where I have a panel of experts, including Peggy Keebler, who is a certified personal trainer. So she'll be talking about exercise, resistance training. I have Dr. Sam Price, who is a naturopathic doctor, and she's going to talk about some supplements and things that we can do based on some of the symptoms we're having and problems we're having with weight management specifically. And then we're going to have Dr. Michelle, who's going to be actually talking about mindset, mindfulness, mindful eating, and she's a big women's health expert that deals with intimacy as well. So we will be talking about everything weight management. We're going to help you get the right mindset for weight management and living a healthy lifestyle in 2025. I hope that y'all can join. Our weight loss consults are on sale, I think for 20% off. So if you are interested in weight management, you want to learn how to do it the right way, you want to have all the help and aid that you need from trained professionals in weight management specifically, go ahead and schedule your discounted consult so we can get started so you can have a wonderful 2025. Because when you're healthier, you feel better, you look better, you're more confident, and you're less likely to be at the doctor all the time because of all this chronic disease that is preventable with maintaining a healthy weight.
So how can they find out about this challenge, Dr. Mia?
So just follow me. Go up on my page, Facebook or Instagram, Me Bella Health and Wellness, or Mia Cowan MD, or Dr. Mia Cowan MD, and click the link. It's free to register. You just need to register, and then you'll get all your reminders so you can be there, learn, and we can all get started on this health journey together. Because I had a good holiday, and I did gain a few pounds over the holiday. So January, I will be working to get back to my normal weight and maintaining that throughout the year.
Good deal. Yeah, in the end, I gained a few, but I'm coming back on this end. I'm excited. I had a great time in Antigua eating lobster and those lamb chops. But I did take some leisurely strolls down the beach, and I still had some water.
Yeah, so you didn't gain a lot. And probably by Monday, some of that salt and stuff will be off, and you'll be back to your normal weight before.
Oh yeah, I'm coming back on this.
But I straight up gained because I really ate this holiday. I was at home and I was with my family and I ate well. But I know I can get off my little 5 to 7 pounds that I gained. And that's why it's important to weigh so you know you gain the pounds and you can get them off when it's 5 to 7 and not 20 to 30.
Exactly. And I did hit the gym a couple times while I was on vacation. If you need a place to go to stay for vacation and that has a good gym, y'all need to hit me up. I tour all of these places just for you guys. But I have an addiction to the scale, and I was getting angry with it because like I didn't like some of the numbers and I called it a liar. But then I had to remember I did eat some. Exactly. But I knew what I needed to start doing. But like I said, the last trip that I had, as long as I've been traveling, is I started drinking more water
Yeah.
while I was traveling. And that seemed to have helped tremendously. So every night, well, at least most nights, I tried to drink one bottle of water before I went to bed. And I
Mm.
was able to maintain. And yes, I did. I did enough drinking. I did eat. I ate all the things I wanted to, but also try to remember things that work well for me, which is
Right.
seafood and chicken. You
Yes.
know,
Yeah.
that works extremely well. I didn't do a ton of carbs because that just works well for me.
Right.
But
And
when I
you
did
figure
come
out
back
what
here, I
works.
did go to Publix and get some fried chicken. Yes, I did, and I was happy. Again, I still had my salad with it, and it's still moderation that works for
Just
me.
get your air fryer. Your chicken tastes better in there anyway.
I have an air fryer. That's how I cook my salmon, which I need to be throwing out today.
Well,
And you're
try keeping
absolutely
your
right.
chicken wings in there.
Yes, my air fryer is good and greasy. I'm a fan of that and my Instapot, which I need to go and get my.
I need to pull my Instapot out and start doing some recipes in there.
You know what I love to cook in my Instapot, Dr. Mill? Collard
Hmm.
greens. I
Oh,
use
really?
yes, I use smoked turkey, and now I'm a big girl. I don't even make cornbread with it because usually I have to make
Mm.
my cornbread first and then make my greens because the greens get quick. They cook so quick.
Yeah.
But yes, I use smoked turkey wings, and I use my cut up greens from Publix because I don't have time to be picking greens.
Right.
And I eat that, and I eat salmon. Use it for the whole week that I'm here, and that's it.
That's
I'm
what's up.
boring when I'm here. I'm exciting when I leave, but it's still about
Right.
that balance because I got to maintain.
That's right. That's
And
right.
one day I'll have that Dr. Mia body.
Girl.
I'm working on it. I see how fine you have
Look,
been
I'm
looking
trying to
for
get the
something
Beyonce body. I'm trying to get the Beyonce body.
there.
I don't think it's gonna happen in this lifetime, but I would like the Beyonce body.
Well, I'll just be Beyonce third cousin. That'd be my goal.
So I hope that y'all are ready for the new year and y'all are ready to live well, age well, and experience everlasting intimacy. Thank you, Comedienne Joy, for joining me this morning. You always make it a lot more interesting when we're talking about all of this healthy living and total wellness. And I will see y'all tomorrow for Ageless Intimacy with Dr. Mia and Joseph. And then I will see y'all on Monday, Tuesday, and Wednesday for the challenge. So let's get ready to go. You'll be able to really help create a plan for yourself for weight management in 2025. And it may not be weight loss. It may just be maintaining your healthy weight that you already are at so that you can develop the right lifestyle tools so that you can keep this weight off. I'm tired of fighting with weight.
Exactly. We got to fight something else, but not that.
Yeah, not weight. All right, y'all. Go be blessed and have a wonderful beginning of your new year. It's Dr. Mia. Bye.